Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Started?
I am. Let's see if we can share the screen here.
Well, most of the articles talk about what's going on today. This is why schools are open, because of the mental health that and the isolation and all the anxiety, as was expected. Mental health has been the epidemic that was expected to follow the epidemic of or the pandemic, and it has not been. We've not been disappointed that psychological distress among the young and the old is one of the biggest problems that remains.
Mm-hmm.
And we've talked about it for quite a while. Yes, Bonnie?
Dr. Callender, do you know what's going on in the other countries regarding anxiety in the children?
Well, I don't think it's been reported. I haven't seen any articles, but I'm sure it's the same thing. I know we've been looking at it for some time. Hopkins reported the marked increase in suicides in the African American young people, and that's been found in young people and older people. And so the mental health crisis is something that was anticipated and is something that is something that we have to do what we can to allow people to take advantage of psychiatric help and to try to destigmatize it as much as possible. And as a consequence, we're talking more about mental health and the needs for us to be open and helpful to those people who are in need. And you saw that number, more than 51% of people are in need because of the isolation that has occurred. And this is, and these are the signs that they're talking about that you find more and more as you talk to people. And that's why schools are open, and that's why many of the institutions that are open are still open. I was disappointed in, and I guess we've mentioned it before, about people's behavior of recent, and we've talked about it as well, that people are not social distancing or masking like they used to. And it seemed a bit premature. And I guess one of the things is because that's another evidence of the mental health problem in terms of not following the rules because you've been victimized so long that you just want to get out. And this then makes it even more difficult with the new variant coming up to get infected and reinfected. So any thoughts or comments about what else you can do to help the people who are around you to actually take advantage of the help that they need?
Well, the article talks about, family, parents getting more actively involved with their children, but some of the parents are maybe just as bad as some of the children and in need of, are stressed, and you hear, they too are going through anxiety issues.
Absolutely. Absolutely. There's nobody that's free. No parents, children, those who are single, those who aren't, those who have children, those who don't have children. So there's no population that's free from the mental health crisis. And the major obstacle, I think, is the stigma that is associated with mental health and the lack of freedom to actually go to see the psychiatrist.
Dr. Callender, addressing what Sylvia just said, if you think about the children, the parents that do homeschooling and children that are home all the time and their parents don't send, they seem to know how to interact, but children and parents that have been separated all this time, they go to school, they're working, and nobody knows how to interact with each other except for discipline or something like that. That does present a problem. But children homeschooling, they seem to be resulting fine. So it comes back to how we relate to each other, and even mental health problems. When we find ourselves isolated and we're all by ourselves, then we need to reach out and have constant contact with the people that we think that are by themselves, or to talk to them constantly. I got one friend, she calls me every Tuesday just to see how I'm doing. And she contacts a long list of people just to keep in contact, and it keeps her fine. And the rest of us, we enjoy talking to her and etc. So people find different ways and mechanisms to do it. And like our family, we started because of the COVID of just trying to get together periodically for the children's sake, so they can be around other children, especially before school started. There need to be interaction among their parents and among probably other relatives.
Well spoken, well spoken.
One more question, Dr. Callender. Knowing that anxiety and isolation was going to be a key factor for COVID, what did the medical industry, how did they plan for this? So that knowing in advance that this was going to be a problem, where is whatever needs to be in place to counterbalance this?
Well, I think that they've talked about the need for this, and they've talked about the availability of the numbers and the efforts at destigmatizing, but that's all they can do, I imagine. And I don't think there's anything else that is planned except to try to educate the communities to seek help and encourage everyone to try to do what you can to help people get away from the stigma of going to see a psychiatrist. I think they've tried to educate the public along those lines. But just as we have been unable to get people to take vaccines, it's the same thing about destigmatizing mental illness.
Dr. Callender, I think a solution that for me would be to, if people are afraid to go to the psychologists and the psychologists, why don't we send the psychiatrists and the psychologists to them? Because they certainly do that in the school system. If, for instance, a child suddenly dies, one of their classmates suddenly dies, they bombard the school system with extra counselors and psychologists, and they just send them to the children. So would that be a solution, to send these doctors out?
Well, you don't want to go where you're not wanted. So these are adults, not children. And so there's no process that I know of where you send people to places where they're not wanted. So that's an interesting thought of a solution, which is in terms of sending physicians to people. But you usually want to go to places where people want you, not, you don't want to be forced upon people.
Dr. Callender, just like they threw all this money, stimulus money for vaccines and everything, they could do that also for the mental health problem. Make it free and accessible so people don't have to pay, because you got to pay out of your pocket when you see that. And in the school system, when someone dies, particularly in the other cultures, they come out for a day or two and then it's gone. Everybody knows that a day or two of seeing a psychiatrist doesn't work. It's a period of months and years for it in order to work. Just like looking at your physician, you don't see them once a year and call it quits. You see them periodically, even once a year for a psychiatrist would be better than what we're getting now. So maybe if they pour some of that stimulus money into that and say, these on the psychiatric department is open, available, and free. If it's related to COVID, maybe.
That's a thought. The biggest problem with that is that who does the stimulus money go to? Who does the stimulus money go to?
To the doctors.
Well, okay, okay. Well, I think that's a thought that hasn't been addressed because the issue is that nobody has sent stimulus money to the physicians.
Okay, and in our medical health care, is that included in our medical health care that you can go and see it? You can see a regular physician, primary care physician. What about mental health? Can you see a physician under your mental health care? Is that covered?
No, it's not. And that's one of the problems. That's why your idea makes sense. It's just that the processes and the procedures have not been addressed. But I think your idea is a good one. It's just not in anybody's stimulus package to see psychiatrists. But as you're saying, it should be, and it is not. So that's one of the items that we could fight for, because I think that would address the problem that was just mentioned, that we have not addressed it in the detail to which we need to because of the mental health crisis that we are facing. And as we face that, we need people like you to come up with thoughts like that help us be more positive in dealing with a solution for this mental health crisis. We've dealt with the pandemic, but we haven't dealt with the mental health crisis that is upon us. But those are some thoughts that you put out that make a lot of sense.
So where shall I direct these comments to, or get a coalition?
To your politicians, your Congress, I think that's where the action has to take place, the Congress of the United States.
Okay.
Because they're the same people who developed the stimulus package. And that's where the action needs to go. This is an article I suggest they put in. It's a Black doctor who tried suicide 3 times. And he has bipolar. And this is the issue that people with mental health issues who don't get taken care of, as you and others today have suggested, wind up killing themselves and others. And so it's worth it to do things in advance like you suggested, which we have not. And this person talked about the fact that he, even though he was an excellent doctor and was winning all these awards, he was still trying to kill himself. And he talked about the fact that when you go into internship, you don't get the support you may need. In addition, he's a gay man, and he's also dealt with depression. And so all of these things are items which the medical profession does not help with. As a consequence, he was accepted in medical school and became a physician, and things just never got any better. And he got medicated and stuff. And then all of his efforts still led him to attempt suicide again and again. He was saved, and he tried new medications, and he tried, and once again, he tried, and he tried to kill himself. And it shows the magnitude of the problem, especially you're talking about somebody who's even in medicals was identified as having a mental health concern. And the problem is that even at best, the internship and residency programs cause you not to get enough sleep and not to take care of yourself. And wellness is a relatively new issue. And we are now addressing it as never before. But here is a gentleman who actually did what he could. As Carol asked, well, who do you talk to? Well, he talked to the medical professional and they listened to him and they made changes as they could. But this is why wellness is now an item that is talked about in the residency programs, which was never talked about before. Understanding that physician heal thyself becomes an issue. It reminds me of Carol, who was so busy taking care of John, who's taking care of Carol. And Dr. Callender so busy taking care of his patient, who's taking care of Dr. Callender. So this is the kind of wellness emphasis that is now being dealt with in the medical community, which was never dealt with before. And bringing attention to this, as well as bringing attention to some of the ideas that you've raised today, is something that will help us in the future as we recognize that your mental health is as important as your physical health.
Dr. Callender, they mentioned this term sleep dysregulation, DYS regulation. What is that?
That means the inability to sleep for whatever reason. Some people have insomnia, they don't sleep at all. Some people can only sleep 2 or 3 hours. And in medicine, during the internship and residency, sometimes you're forced to go to sleep 3 to 4 hours a day. And that kind of dysregulation of sleep is bad for your brain. Because as we know, the brain, when you sleep, the brain gets cleaned out. If the brain is not cleaned out, then your thought processes are interfered with, and that kind of sleep dysregulation is common in the medical field. But it's even more common in people who have mental health issues.
Dr. Callender, this makes you think now about the doctors and the nurses who are dealing with COVID, on a 24-hour basis, their mental health and trying to not only deal with the COVID and the illness and seeing people dying, and it just makes you think, how are they how are they getting their rest?
They aren't, and that's the crisis, and that's why wellness is becoming one of the most important issues in medicine today. It was never addressed in the past, but it is now being addressed aggressively. It's an article again on exercise, and this talks about the mechanism about how exercise protects. And this was based on some work done in Australia, which looked at what are the end results of exercise that makes exercise so invaluable over time. How does it increase the length of the telomeres? How does it cause you to have better health if you exercise? And it identified a factor that is associated with exercise. And they found that this product increases the more you exercise. And this product results in a decrease in insulin resistance. It also results in skeletal muscle activation. And they call the enzyme NOX4, which is the product of exercise. And when you go for those walks in the morning, and you go do that exercise, the aerobic exercises or the resistance exercises, NOX4 becomes abundant. And this leads to reduction in insulin sensitivity, which is, yeah, diabetes is the consequence of insulin not being effective as you get older. And one of the consequences of NOx4 is it reduces the effect to insulin insensitivity. The interesting compound that is thought to be associated with it is broccoli or cauliflower. I don't know how many of you like broccoli or cauliflower, but those cruciferous vegetables seem to have a lot of anti-aging effects. And the question is, can you eat enough to do it? And if you don't, you need to be exercising. And so those of you who exercise, this just is a way of identifying the consequence of exercise according to these Australian scientists. Any comment about that? Because I think that's, any of you like broccoli or cauliflower?
I do.
I do.
Brussels
I do.
sprout.
Yeah, well, exercise and eat broccoli and cauliflower. Okay.
I don't know why I don't like Brussels sprouts though. To me, they have a funny taste.
Yeah, well, broccoli doesn't have much of a taste.
Oh, you need to bake your broccoli.
That's what I heard. Somebody, I did have it one time. It might have been wrapped in bacon.
Delicious, delicious olive oil, seasoning, and crispiness. Delicious.
Maybe so.
Okay, Sylvia, I'm coming over your house to get some baked broccoli. I'll
I
be
have
there.
I have
I'll be
some in the
there.
refrigerator.
Okay, I'll be there at noon today.
Okay, I'll put it in the oven.
Also, you got to put cheese on your broccoli.
There
No,
you
no
go.
cheese.
Oh.
You don't have to. You don't have to.
You want
Okay,
to.
John Tatum.
Velveeta.
And paprika.
Oh, look out. Try that.
Of course, the other option is just exercise. Then if you exercise, you don't need as much of those products. I thought we'd add this article because we talked about it the first time it occurred.
Yes.
And xenotransplantation, I think, is one of the things in the future that was going to be necessary, because while we did more than 40,000 transplants already this year, which is the first time we've done that, the donor list is still about 100,000, and 20 people die every single day because of the shortage of donors. So the inability to get enough human organs is a reality. And so getting xenotransplants or transplants from other animals is something that, if it works, may turn out to be one of the things that will help us. Of course, tissue engineering and stem cell transplantation are different other modalities that will accomplish the same thing. But I think genetic engineering, first we have to understand that the pigs that they've used have been genetically altered, so they don't have the antigens that usually cause rejection in humans. And so this has implications that are widespread for the future. And if these two transplants work, then of course the anti-animal rights people will begin to complain again. But the question is, if you had a chance of life with animal organ or death, which would you select? Any thoughts or questions about this?
Dr. Callender,
news?
for individuals who have passed because of COVID, are their organs able to be used?
People who have, what's the question again?
People who have died because of COVID,
Oh,
are
no.
their
No,
organs
if
are
they
not
have-
able to be used?
If they have COVID, their organs are not utilizable. Now, if they are free of COVID,
Mhm.
and we have had people who have been free of COVID who have received transplants successfully, but we've not used organs for people who have COVID, because it's an infection like any other infection, And when you have a transplant, your body is immunosuppressed, and therefore you're likely to die from infection if that's the case. But if the organ could be freed of the virus, then it potentially could be useful. But no one has used COVID organs for transplantation. Now, this is an article on the fact that RNA vaccines are, while they're not new, this article talks about how they were developed in the 1990s and were actually not used for vaccines until now. Although the technology has been out since 1990, they have not used that in a vaccine until now. And the use of it has been a tremendous success. And the thought is that this kind of technology may be the way in which vaccines will be made in the future, because the success, the immunity that is established has been good. There's another article we'll talk about a little later that talks about another novel way of creating vaccines. But this is something that, while the vaccines go back to 1700s and maybe before that, because in Africa they were doing vaccines as well in a different way. But the modern technology up to 1990 was not to use RNA. But as of 1990, the RNA vaccine technology was developed. And we now know that this may be the wave of how vaccines will be used in the future. As you go down, the article talks more about how what is different about the vaccine that makes it work, and the fact that the proteins actually work on the proteins in the cells, and that these proteins modify the proteins themselves, and that therefore your antibodies that are produced come straight from your own cells. So they only encode a small part of the pathogens, and they, of course, can't give you an infection, as some have erroneously alleged. And so the fact that the RNA goes into the cell nucleus and triggers the immune system to develop itself makes it very attractive and effective. And so we've made a giant step forward with this technology. And of course, there are those who feel that it's too fast. Well, it saves lives. So we have to be grateful for the rapidity with which we're able to take this new technology and use it to get our own immune systems to work even faster and better. And then the thought, of course, is that eventually there'll be technologies like this for cancer cells, which haven't evolved as yet, although they're in the process.
Dr. Callender, how does the DNA process differ?
DNA process is the basis of life, for example, is DNA and RNA, because they're in the nucleus. And the DNA also is a messenger. It's just that the RNA seems to turn things on faster than the DNA. It's interesting. Somebody is called Omicron because it's affecting so many people. So having breakthrough infections is something that is kind of almost being expected. And because this variant of the virus is more infectious than Delta, and maybe as damaging as Delta. It remains to be seen. There's a lot of studies on it, but we're not sure about it. But we do know that breakthrough infections are occurring. Although the mortality rate is 14 times as high in those who are unvaccinated, we still have deaths in those people who are vaccinated. So following the guidelines and being careful about interacting with people who are not vaccinated becomes an issue. And with people who are vaccinated. And as we are in the flu season now, the flu will cause a lot of confusion as to whether it's the flu or whether it's COVID. And the only way to tell is to to be tested.
Dr. Callender, my husband, he tested positive for COVID even after having his booster, and they gave him an infusion called, I think it was Regen-CoV.
Right.
Do you know what that infusion is all about?
Yeah, that's monoclonal antibodies that have been used for some time. The same antibodies that were used on President Trump and the neurosurgeon, black neurosurgeon. So this has been out now for months, and has been effective with overcoming the coronavirus infection. The only question the only thing they don't know as well is how effective the Regeneron monoclonal antibodies are against this variant, but it has been effective. I think in some studies it's been in the vicinity of 70% effective at eliminating the virus. The only difference is they know everything about its effect on COVID, but they aren't as sure about the effect on this variant.
Dr. Callender, when somebody is tested positive for coronavirus, do they know immediately what strain it is?
They nowadays, yes, because they now have the test that can tell which variant it is. Yes.
So does John, do you know, and Sylvia's husband, does he know, and Daryl Armistead, does he know?
I can't
I
answer
don't
what they
know.
know.
Yeah, I don't know. I have to look at my report. To me, it really doesn't matter.
Right. Doesn't.
Well, it does matter in the fact that some of the vaccines are better for some of the variants.
It doesn't matter because if you have the disease, you need to be treated with the antibody. If you need hospitalization, and if you become sick, then you need to be treated with the antibody that is effective against the variant that you have. If we know, right now, the Regeneron and those monoclonal antibodies are effective against the variants that we knew of before, but we haven't done enough tests to tell you whether the Regeneron is as effective against the Omicron variant as it is against the Delta and the Alpha.
Yeah, that's why it's important to know.
That's why you don't, and that's why we don't. It doesn't matter now because we don't know the effects of the Regeneron against Omicron. So we just have to treat it and hope for the best. We also have a pill that's used. It also is the same as the infusion. But here again, none of that has been tested against Omicron. So time will tell. But right now, it doesn't really matter. You want to recover from the illness.
Dr. Callender, what is infusion? What does that mean?
Intravenous. That's what infusion means. It's a medication that they give by vein, and that's what infusion means.
Now, Dr. Callender, they wanted him to come back in 90 days, maybe for another shot. I guess because of his age, they indicated, but.
Well, I think as we know more about it, we may know whether he needs to come in before 90 days. It depends on how he responds to treatment. There's evidence that once you get a breakthrough infection, you are super immunized, but time will tell. We need more time to study the effects of the Regeneron on the Omicron variant. We don't know as much about it as we know about the others because it's relatively new.
Dr. Callender, how often should you be tested for the virus?
Well, I think whenever you have any symptoms, you should be tested. There's so many different protocols. Howard, they want you to be tested every week. So I think whenever you have symptoms, you need to be tested. Right now, we have protocols, but we don't know whether or not they're the best protocols or not because we just don't know. I can't tell you.
You asked me,
but it's clear if you have any symptoms.
Oh yeah, but I'm just saying. For instance, I haven't been tested since May, and it was because I was in for a procedure, and I had to be tested before I could go in for it, and I haven't been tested since. I've been fine.
If you get symptoms, you should be tested.
Okay.
If you don't get symptoms, there's now evidence to indicate whether you should or not, except that if you're working in a hospital, they will probably want to test you every week.
Yeah, that was the answer to your question, Doc. You asked me why I got tested. That's because I had a cough and a sore throat, so I was concerned that I might have got it. But since I did have the vaccine and the booster, my symptoms were just like a cold. I've gotten a cold a ton of times being in the studio singing on a microphone that was not sanitized, and I should have known better. In fact, that's what I thought it was. I worked Saturday night, and I should have used my own microphone.
Well, there's so many places you can pick up the virus. So. Now, I think one of the most important things to do is, let's say if you are exposed to somebody with COVID or something like that, then that's another reason why you might want to be tested. If you're around someone who tested positive for COVID, you might want to be tested. Or if you're symptomatic, you may want to be tested. And those who come back to school, there's an article on that, will have to be tested once they come back to school, regardless. And then they will be tested thereafter if they become symptomatic. One thing that's important as we face the Christmas season and we go to events that are inside that are associated with people who have not been vaccinated and people who have been vaccinated, is to try to remember to use the social distancing and masking as much as possible.
Dr. Callender, going back to the microphone, and let's say you had a microphone that was not sanitized and you used it. How soon could you pinpoint that it was the microphone? Or could you pinpoint that it was the microphone?
If it's not sanitized, I don't know how you can prove it unless you test the microphone itself. Because what you're saying is that the virus is on the microphone, which is expected. And that would mean somebody before you was COVID positive. And that's presuming that that's the source, but it could be other sources as well.
Yeah, so that means it's very hard to try to pinpoint.
It's not easy, right? Mhm. Unless you test the microphone itself and test the people who use the microphone. So,
Is there any kind of incubation period?
yeah, his incubation period is probably 48 hours. The isolation period is an interesting uh, concept that has been changing because people who have been vaccinated often will have a shortened uh, period in which they'll stay positive. And so questioning the need for 10 days. And as you can see with some of the basketball players, not to speak of the false positives like LeBron, they often do not have to be isolated for 10 days because they turn negative in shorter periods of time. So they're saying that you should depend upon the test and the symptoms. If you're symptomatic, obviously you should be isolated. But if you become asymptomatic and you test negative, do you really need to have the 10 days? And most people believe it should be shorter. What are your thoughts? Do you think that the Christmas holidays will make things worse? New Year's holidays? If you notice, the DC has gone back to requiring masks in events that are held inside. I know the recent events that I went to, I was disappointed that they didn't require face masks, and they've changed that policy now.
Now the policy is going to be you have to have a vaccination. You have to have, in order to get into restaurants and other places, you're going to have your vaccination card.
Which
That's in
should not
DC.
have changed.
Yeah.
Should not have changed before. But anyway.
I got a couple of points that I want to ask about. First, you said, do the holidays make it worse?
Yes.
I would say yes, because of two reasons. There is the anxiety of people not being able to get together like they normally would in that season and give each person 8 hugs a day and all that kind of stuff. That's the anxiety part. The other part is the fact that you don't know who's positive and who's negative. And so you got to stay away.
Yeah, and time will tell. But time has already told the incidence of the positivity is going up astronomically. So it's clear that yes, this is an issue that is going to strain our healthcare system again.
Do you think this is because of Thanksgiving? This is a surge from
Yes.
Thanksgiving?
Oh, I think it's because of Omicron. I think it's because of the Omicron variant.
Oh, okay. It would have spread anyway without Thanksgiving.
Yeah, I think so, but it's going to take us time to tell. which had the greatest impact, the Omicron or the Thanksgiving? I think it's Omicron. But now this is something that's scary. What happens if you test positive while traveling? What do you do? One of the things is if you're out of the country, you're not going to be able to get back until you're negative.
Yeah.
So
I have a
that's
friend that just went to South Africa and they were there for 3 days and got COVID. The whole family did. Husband, the wife, and 2 kids got it.
so they had to stay until they're negative, right?
Yeah, they plan to be there for a couple of weeks. So
Oh,
yeah, they they'll probably be okay by the time they get to come back.
yeah. But it's a fear. It's a fear. What's the odds of testing positive if you're vaccinated? We don't know the answer to that question, but we will know shortly, though.
Well, we had 3 people on this panel that was fully vaccinated and they got the virus. So, and it seemed like my brother was telling me he had performed at 3 different localities and it was packed. And it was through his performance, one was in Milwaukee, Chicago, and another area. And each of the venues, the concerts were packed. So maybe John Buchanan, you were saying you were also performing.
He told us he was 600 people where he was. So, yeah.
Mm-hmm.
Yeah, it was packed. They did a pretty good job of insisting that everybody had the mask on, but people were around their dinner table. You don't have a mask on while you eat.
Yeah, it doesn't matter.
If you're
Can't have a mask while you're
indoors
eating.
without super ventilation, I mean that's
Yeah.
a breeding ground.
Yeah.
There must be a phobia associated with getting needles, because I know if you have a trauma, as a child, you might have a fear of needles.
I mean, you say that to say what? What's your point, John?
I might not have a point, but I'll try. Let me see. My point is that some people, rather than saying they are not going to get the shots because
Well, I think
you're taking my rights away, that's one reason. But the other reason is needle phobia.
It might be afraid of needles.
Yeah.
Well, I think most people are afraid of needles, but you overcome your fear of a needle because the fear of death, and so.
I can vouch for that, and Dr. Callender is one of the main reasons that I was able to get over that fear. When I heard him speak about the lack of African American donors, that's when I decided to give it a shot. I mean, I was at the NIH and I heard him speak about it, and they had a Department of Transfusion Medicine right there on the campus, right around the corner from where he spoke. So I gave it a shot, and it hurts. I mean, the needle for a blood donation is twice as big as the regular.
Right.
I mean, it's like a pipe, attached to
Yeah.
your vein.
Right.
So after that, I mean, a vaccination is nothing. It doesn't even compare.
Well, those of you who are traveling international is another issue. Traveling locally is one thing, but traveling internationally is another thing because they're not going to let you come back until you're negative. The one thing that's nice is that I think I was talking to somebody who told me they have hotels are equipped to do tests on you and make sure that you're negative. And if you're not negative, you're not going to be able to travel.
Oh, those tests in the other countries, they might be $50 or $60 per test.
How much?
$50 or $60 per test.
Yeah, so you got to, wow. Money is the key to, the love of money is the key to all evil.
Oh boy.
Now, I just recently bought another test kit because my children are coming in from Illinois and the state of Washington. But I noticed when I went to CVS, the test kits were no longer, on the shelf. They were behind a locked glass case. And I asked the pharmacist, why are they locked up now? He just said they're walking away because
Oh yeah. How
but I
much were
understand
they?
it's hard to find them now. And
Yeah.
I don't know, Biden, did I hear something regarding Biden was trying to make them available in January?
Yes, that's correct.
We
That's
have an
what
article.
his new plan. I noticed that many CVSs are closing because of people stealing. And it's interesting that we're sometimes our own worst enemies.
Mhm.
It
But
should
I
be
know,
like Walmart and check your packages and your receipt.
well, it's there's an epidemic of stealing as well. And especially during the holiday season becomes even worse. But I know there are two CVSs close to the hospital, both of them closed.
Wow.
How much do the tests cost in CVS?
The test kit was, I think, $21,
Mm-hmm.
19 for some tax, 20, about $21.
I
Wow,
think
that's a
that's
steal.
I think mine was from CVS was 28, but it gave you it gave you two tests in the
Yes,
box.
there's two in the package.
Right.
Yeah,
Now
that's
my son just his roommate just took 3 tests in one night. Why he did that, I don't know, but 2 out of 3 were negative,
Mm.
you know. So my son is assuming that, well, 2 out of 3, that's not bad. I said, well, just continue masking up and ask him to mask up
Yeah.
and just
Well,
get out of town and go to your mom's.
that's right. Yeah. Well, this is one of these studies that says that after you get your breakthrough infection, you become really immune. It's interesting that these tests show that 2,000% increase after your breakthrough infection. So now that they of course don't know how long that super immunity will last, and it's going to be interesting to see whether this means that this will last for days, weeks, months, or years. So time will tell. You know, there were some articles that were initially indicating that this variant was not associated with as much mortality as the others, but it's too soon to tell, to be honest with you. Time will tell. Remember, there's getting mild cases of COVID are one thing, but 50% of people who get COVID who are unvaccinated get long COVID, which means that they have chronic infection with COVID. Now, this is the pill. You talked about the infusion. for COVID treatment. Well, this is the pill that does the same thing that the infusion does. But again, this is for the not for the Omicron variants. We don't know the effectiveness of this for the Omicron because that wasn't tested. So this is going to have to be tested to see if this is effective against the Omicron variant as well. But this then would be the pill that would be used in place of the infusion, because this is a treatment rather than a prevention. It's the Regeneron pill, so to speak.
So for those who are not vaccinated, is the problem the needles? Is the problem putting the antibodies in your system? What is the problem?
You'd have to ask those people who are not vaccinated, because we're a group that are vaccinated.
I asked some and they're like, I just don't want to. And I'm like, where's your research? You know, what, you're not standing on any scientific grounds, but I have several friends who still are not vaccinated.
Yeah, I've had friends who are not vaccinated and are dead now. And it's painful to see people who still refuse to be vaccinated without good reason, as you mentioned. But they're around.
Yeah, that old saying, a mind is a terrible thing to waste. You can't, to deal with someone's mind, to make them think something or feel something. Some people take scientific research and logic and reasoning, and then there's some people you just can't reason at all. They just feel it, they think it, and so they are.
Well, this is interesting that this medication, 89% effective at getting people cured who would otherwise have died from the virus. And it's interesting that the United States will pay $500 for each course of Pfizer treatment. I don't know what the overall cost is. But it's nice to know that they have a pill that will be as effective as the infusion for those people who don't want to take infusions. This is a study that was fearful for some, because they're suggesting that if you don't get a booster, you're not fully protected against the variants. And that one shot is not enough, or 2 shots is not enough. You should have 3. And so getting this information around so that everybody gets a booster becomes imperative. Doesn't say that you don't have neutralizing antibody, but you don't have enough. And so the booster shot then becomes critical. So those of you who have who have Christmas dinners, and you have people who have not gotten their booster shot, what are you going to do?
They're going to eat downstairs in the basement.
Not with me, they're not. No, just give them a pack. Say, here's a take-home plate. Go.
Right. Not even come in.
Yeah. Well, will they tell you the truth about the booster shot?
Show your card.
Still at the church, they still, Asbury's been going on since September, and using the trust system that they believe what you say. Because nobody asked for a vaccination card.
Yeah, but the mayor's gonna close y'all down. She's getting ready to tell you that public assemblies have to go backwards to what they used to do.
This is based upon what, John?
His announcement, her announcement.
John, there's no announcement like that.
Yes, she is. She's getting ready to announce that public assemblies have to go back to what they used to do, as far as the number of people, social distancing, masks, the whole
She's gonna
nine.
say that today?
It's coming.
Yeah, I think I read something about that she's indicating that you have to show proof of vaccination. I know in public places and public transportation, but I'm not sure regarding like in social gatherings like a church.
Yeah, well, I was considering a church of public assembly,
Mm-hmm.
but maybe I should separate church and state.
Well, it's going to be interesting to see what she does, because the data are impressive, and I have the impression that she's going to be reluctant to go back to the way it was before. But time will tell. They usually make the announcements on Wednesdays, right? She didn't make it yesterday. So.
I think
Well,
I
it's
read
gonna be
that yesterday. I read that information yesterday.
Yeah, but that information doesn't say that the churches are closed, though.
No.
They're gonna require proof of vaccination.
Yes.
Yes.
But it doesn't say it requires for example, at the one Capitol Arena, it's not required.
It will be
Only
though.
required is that you wear a mask.
It will be though.
No.
That's what the mayor just said.
I think that's what she's saying.
I think I saw it's January 15th is gonna be the cutoff. Yeah.
Mm-hmm.
Everybody going inside movies, restaurants, bars, anything like that, where public gets together, they're gonna have to have proof of vaccination.
Right.
As of January 15th?
Yes.
Yeah.
Oh, that's a long way off. That's a long way off. That's interesting.
That gives you
Because there are
enough
many
time.
events that take place before January 15th.
That gives you enough time. I was watching a football game the other day, and it's in, I think, Wyoming,
Give me a pack of.
and there was like one mass. It's like a crowd. The scene that they were showing, maybe 100 people, maybe one person had a mask on.
But that's outdoors, right?
Yeah.
Yeah, outdoors is a little different. But indoors, where you have many events, is kind of scary the way I watch these people. They don't put on masks at all.
Yeah, it's a little. That's kind of stupid at this point, right?
Yeah, and well, of course, they just changed back because the mayor finally they sent out a notice. They didn't say that you need to have vaccination though. They just said you need to wear masks.
Yeah, one of my bowling buddies keeps his mask on his chin.
Oh, is that a new way of wearing a mask?
It's a protest to me, you know.
Oh yeah, that's what it is. Yeah.
Lately, I've been hearing about a lot of false positives. You're positive one day, of course, you're going to panic. And then the next day or the following day, you're tested again and you're negative. What causes that? The equipment or the person administering the test, or?
I don't know why you have false positives. LeBron James was a good example of that, but I don't know. why there are false positives, but there are. And the proof of the pudding is if you are positive one day, you should be positive the next day.
Exactly. Yeah.
So
Mhm.
I don't know that they've identified why there are still false positives. And that is what is frightening about the home tests. How do you know which of those is right?
In the case of LeBron James, it could be attributed to news sensitization.
To what?
I said in the case of LeBron James, it could be because of news sensitization. You know how newspapers like to be the first to get the hot stories out.
Well, that was just for the first test, but it was a false positive because the subsequent tests were all negative. Yeah, and you're right. The news, as soon as they find something like that, they do sensationalize it. But
I found the article regarding it says DC will implement vaccination mandates for indoor gathering places in the new year. As of January 15, 2022, all individuals 12 years of age and older will be required to show proof of at least one dose of the coronavirus vaccine to visit indoor restaurants, exercise and recreation establishments, culture and entertainment facilities, and indoor meeting and event spaces.
as of January 15th, but I mean,
Yes,
why wait until January 15th?
Right, exactly.
That
I
doesn't
don't
make
have
sense
that
to
answer.
me. That makes no sense.
That means
They want
party
you
all
because they
Christmas.
want you
And
to
after you're
they want
done
you to visit.
partying,
They want you to travel during the holiday season.
yeah,
You know,
get your
it's all
But
money.
about the mighty dollar, you know?
Yeah, we're gonna get your money.
I mean, that's yeah, that's what it sounds like.
Yeah, yeah.
Yeah,
I
that's
mean,
what it sounds like.
they're not gonna shut down like they shut down before. You know, the economy is in such bad shape now. It'll get worse if they say close everything up again.
Yeah, I think that's why, because it doesn't make biological sense, but it does make economic sense. So which matters most?
Hmm.
The dollar, apparently.
Mhm.
Yeah.
Sylvia, I didn't hear churches on your list either, by the way.
It said indoor facilities, didn't it?
Yeah,
But it doesn't give a limit either. See, before they had a limit.
It says an indoor meeting and event spaces.
I know, but what I'm saying is what's different this time. Before they gave a specified number of people that could meet on this, and this doesn't say a limit.
No, this does
But
not.
it does require the indoor meeting to at least require you to demonstrate that you've got a booster shot, which
Yes,
they never
show proof. Yes.
they never did before. They still don't. Right? I never understood that, frankly. Why you should trust people is beyond my comprehension.
but the whole
Yeah.
thing still gives mixed signals. You get vaccinated. Once you're vaccinated, you're supposed to be boosted. But
Right.
whether you're vaccinated or boosted, you still get COVID. So I know
Right.
some that haven't been boosted and said, why bother? I'm gonna get COVID anyway. So how do you give someone a reasonable idea to move forward to get your booster? Get your booster anyway, you may not get vaccinated. But here's Joe Blow, who's been vaccinated and he had everything. Look at who was it? The governor who had been boosted and he got COVID. I don't know. It's confusing. You try to do
Well,
everything.
it may be somewhat confusing, but the evidence is that those people who are not vaccinated die 14 times as often as those people who are vaccinated.
Right.
And that's a data item that to those who want to survive becomes important. So that and then if you're boosted, your likelihood of having breakthrough infection that's going to kill you is decreased. So the data is clear on that. But the softness of what you talked about for January 15th is confusion because it doesn't address the details. It should say you need to be not only have a booster shot, not only have a vaccination, you need to have a booster shot, but it doesn't say that. And that looseness is problematic to me because it leaves the door open for many people to have breakthrough infections.
I think they're giving you a couple of weeks to get your shots in.
Intent. But it's also opening the door for many people to get infected.
And the mandate really only says you can have one shot.
Yeah, that's not enough.
Yeah, and John, as far as churches are concerned, churches are exempt. So I guess they feel like we can just rely on God. I don't know.
Churches are exempt. That's too bad. That's too bad.
That is
Yes,
too
it
bad.
is. It is.
Because that means the church people can just go ahead and die.
Yeah.
Well, that means that
We-
yeah. See, what bothered me always was the trust issue, that you trust people to say that they are vaccinated when they are not.
Hold,
And
hold on a minute.
Oh, I didn't know you're still at your meeting.
Yeah, hold on.
Okay.
so, well, so we'll see what happens. I'm fearful that the numbers will promote even more hostile activity. Because if we start going back to people dying and ICUs being packed, then they're going to have to do it. But then I guess they would say, well, we were forced to do it. We had no choice. But in the meantime, you're right. That kind of legislation makes people even more confused.
Our group was getting ready to sing for this church that was opening up, a large church, and they took the mayor's advice to heart that they're not going to even open up. They were going to open up the day after Christmas. And so they're not going to open up at all because of what the mayor said. But they had sent out permission consent forms that if you got COVID, when you attended their service, and they wanted me to send the list of everybody that's going to perform or sing and their addresses and everything. They just went everything to the letter. And then when they found out that what the mayor announced, they decided not to open up. But another question I have is, these churches that have opened up and they have this contact tracing, if one of the members call and say that they had the COVID, does it mean that everybody that attend that church service has to go and get tested?
It means that they will be notified. They should be notified. That's the purpose, because they take the email address and telephone number of everybody who attends the church service.
So I know one church, they have about 200 people attending on a Sunday morning service. And I don't even know if they consider that. They got to contact everybody.
Well, I think the only thing about that is that you said that churches are exempt. So if churches are exempt, it's interesting that that church chose not to be exempted.
So your church, do they have that contact list?
Yes.
Okay.
Everybody who attends the church has to leave their contact information.
So how many attend your church?
I say anywhere. First Sunday is probably more like 100, and the rest of the Sundays are more like between 50 and 60.
Okay, they must have communion first Sunday.
Yeah.
Okay, yeah.
And they pass around individual packages for community. Now, what happens when the flu meets COVID-19 is something we'll find out. Now, the question is, does everybody who has coronavirus vaccine have the flu vaccine? And I'm not sure that The answer is clear yet.
Well,
But
last
that-
year you said it went down. The flu went down because everybody wearing the mask and everything.
That's correct. What'll happen this year? We don't know.
We didn't have the Omicron last year.
Yeah, but we had Delta.
Yeah, Delta was, yeah. But the question is, how many on this call already have the flu vaccine as well?
I do.
I did.
I did.
I
The
did.
symptoms are so similar. How do you
Mhm.
tell the difference? If you haven't had the flu shot and you go to the doctor, he can say you have the flu, but is it really COVID? I mean, the
Well,
symptoms
he
are
should do a COVID test. He should do a COVID test. Because of that very reason. The only way to really tell is to get a COVID test. But to get a cold or anything like that, one of the things that you might want to do is get a COVID test.
My
Because
my
treatment is
test
different.
had my test had a whole range of viruses that they tested for. It wasn't just COVID. It was the flu
Right.
and
Right,
a couple other things that they tested for.
right. Because there are a number of other viruses that cause colds. So, but the only way to know is to do the test for it. And so it's going to be interesting to see the impact of the flu this year, because the question is, everybody who's getting the coronavirus also getting the flu shot? So we'll find out over the next month or so. Carol, is your church still not open?
Oh, my home church is open, yes. They have up to almost 200 people there on Sunday.
How many?
Almost up to 200.
Oh, wow.
And they had them in the balcony. That's why I was thinking about their contact tracing. You know, they write down everybody's name and everything, but contacting everybody if someone has the coronavirus. I was just wondering.
Well, they are required to do it now. Whether they do it or not is another story, because it requires the person who's positive to call in and let them know. Although with contract tracing, if they know that you attended the church service, they would, the DC government would call the church.
Mm.
That's where
I'm sorry, but there's a lot of lying going on in the churches too.
Oh,
And that's the reason they go to church, so they can try to stop lying.
is that a reason to go to church?
John
David?
Tatum, I'm gonna give you breakfast, baby.
Breakfast.
Well, it's gonna be interesting. I guess time will tell about what's gonna happen with the flu. So we'll just wait and see. In the meantime, all of us on this call have gotten the flu vaccine as well as the COVID vaccine. So we'll hope for the best. Yeah, that's right. The Novavax has done the DNA vaccine and is approved.
What is that?
That's being approved, but there's another one by India, I see. So many vaccines now that it's interesting. All these vaccines are still the continent of Africa and Haiti are kind of on the outside looking in. The question is, what's going to happen with Haiti, because they don't have a government.
Mm.
Since the president is down and it's anarchy. And how do you get a place like Haiti to get vaccinated? How do you get the continent of Africa vaccinated to the same extent as the rest of the world? But this is an interesting look at the globe to see the DNA and RNA based vaccines. Now it's going to be interesting to see in the future how many of the DNA vaccines will give way to RNA vaccines. I think the expense of it may be prohibitive unless the RNA vaccines can continually report a 90% efficiency rate, which not many of the DNA vaccines can identify.
Mm.
And much of it is not discussed, the cost of the vaccines. So I think that it's interesting reading, but the bottom line is that they're going to have to look at RNA versus DNA vaccines and look at which is the most efficient and produces the most protection, and that will go a long way to identifying which will continue to be the methodology of choice. But that has not yet been done, so we're a long way from that.
Mm.
And I think this is really the last one we'll do is how to stay safe during the holidays, which is the important question of the day. And I think we all know the answer to that, but this proposes to address it. So going down the line. Social distancing. Watching for symptoms. I like the fact that John had his pulse oximeter, so he could test. He has a thermometer, so he can test his temperature. Had his pulse oximeter, so he can test his oxygen level. And he was aware of the symptoms that go along with it. And did you have loss of taste or smell, John?
No, sir.
That's
Thank
interesting how you didn't have that, which is thought to be one of the symptoms. And that may be a consequence of the vaccination.
Yeah, he's
No,
never.
he just doesn't like Brussels sprouts.
Never did.
And I thought a high fever was also one of the symptoms.
Well,
You
yeah,
didn't
it
have a
is.
fever, did
It
you,
is.
John?
Yeah, it
No.
is.
John,
Yeah.
did you have a
that.
fever?
No fever.
No. And it's thought that the vaccine will prevent against that, but that isn't always the case.
Dr. Callender, the thing about a fever is that it could be an indication of other illnesses besides COVID.
Right, but if you have a fever, you need to be treated. So that's the one symptom that is very serious. Low oxygen
how to get a refund. My brother, he was coming here for Christmas, and the airlines are making it so convenient that you can use it later on rather than give you a refund. So that was the easy part for him, because he was supposed to come in tomorrow, but he had to cancel his airline. So I think they're making it a lot easier than what they used to do.
How's he doing?
Oh, the same as you. Both of y'all are the same. Both of y'all are gigging. So, but his symptoms, they sound like yours. No fever,
Okay.
sore throat, coughing, and he went and got himself tested, rapid test.
I think these things that they list here are the things that you need to pay attention to as you quarantine yourself when you, all right.
John, do you have COVID now? And were you just recently diagnosed?
Yes.
Yesterday.
Oh, okay. See, that happened to my sister. She was diagnosed Friday, and she really didn't think she had it. So she was tested Monday, one of these rapid tests, which was negative. And then when she was diagnosed on Friday, they did the rapid. And then what is that, PCR or whatever?
Right.
Yeah.
Which she got those results a couple of days later. That was negative. And then she tried it again. That was negative. So what was this positive? And that's why I think it must have been a false positive.
It was.
She has 4 tests in a matter of 5 or 6 days. And the very first one was positive, the other one negative.
That's why that means it's a false positive.
Mm-hmm.
This is a good article that you should read because you never know how, what situation you'll find. Now, this part is important that if you test positive and you have symptoms, they are suggesting if you don't improve, that you need to get the monoclonal antibody infusion that your relatives got, somebody mentioned that the relative got that infusion.
Yeah.
And they're recommending that in those people who are not improving.
What's the day his birthday is coming?
It's 15 years ago he died. Then we got 4 years.
Why don't we stop here because I've got to leave at 10:30.
More than 4 years.
Oh, it's 10:35, Dr. Callender.
Right, I know. Okay.
Okay, Merry Christmas.
Well, I
everyone.
wish everyone to have a Merry Christmas and a Happy New Year. See you next
Same to
Thursday.
you.
Yeah, thank you, doctor, and everybody
Thank
else.
you, everybody.
Thank you.
Stay safe.
Merry
Stay
Christmas,
safe.
everybody.
Stay
Yeah.
safe.
John, get well
Bye.
soon.
Thank you.
Mhm.
Happy
Good to see
holidays,
all of you
everybody.
today.
Praying for you, my brother.
Thank you very
Okay,
much.
thank you.
You know him then.
All right.
All right.
Bye.